Hi, Mac Performance family. Welcome to our weekly live stream here on Facebook. For those who don't know me, I'm Dr. Melissa MacDonald. I'm a sports chiropractor here in Edina, Minnesota, and tonight we're going to be going over why back pain is not normal. This is part 2 in a series. Don't worry if you didn't listen to last week. This is going to be completely different. I don't have anyone else with me today, so we're going to go through everything we need to know about the low back and discuss some things that maybe you've been told when you go to your doctor or your chiropractor or anyone else within the healthcare profession. So if you're watching this live, hashtag live. If you're watching this on replay, hashtag replay. Please, if you come up with any questions, or if you've ever been to a doctor or a chiropractor and they've said something and you want it explained further, go ahead and toss a comment in and we'll go through it, because I want this to really be about you getting the information you need to have the healthiest and best life so that you can keep moving forward. So I see we have Tim. Hi, Tim. Good for you to join us. Always wonderful. And we will get right into this. So, low back pain or back pain is not normal. And this is something to recognize the fact that, hey, it is almost becoming accepted that you have some form of low back pain in your life or some form of back pain. And guess what? You shouldn't have to. Hey, Jessica, it's nice of you to join us this evening. So, with the back, whenever you go and potentially see a provider for back pain, they might take an x-ray. And these are two very standard low back views. They're of the front, which is on the left side of the spine, and then you have a view of the side on the right. So if we're looking at a spine, one view is looking at it from this direction, and another view is looking at it, let me see if I can't match, there we go, from this direction. And when we get a lot of the gray in our x-rays, that's really just a bunch of different things sitting over it. Because think of what everything is when you take an x-ray through your belly. You have all your intestines, you have all your muscles, you have all that extra squish possibly that can just create what we would call a confluence of densities. Basically meaning there's a bunch of different things overlaying each other. But what we're going to be focusing on are the bright bones in the center of the spine. So what I did is I took some time to just create some color so that you can kind of see what are our 5 lumbar vertebrae, what are our discs, and what is the sacrum. So we have our 5 lumbar vertebrae, 3 are blue, 2 are red. I did this just to kind of help differentiate and then be able to show you on the lateral view how they kind of line up, because especially on the front view, that 5th one, that very bottom vertebrae before it gets into that orange sacrum, gets a little squished because it's tilted and it's not as easy to see. But then when you look at it on the lateral side, it's a big vertebra. So I'm going to pop, let me just click here. I'm going to go right here. So when we're looking at this lateral and then to the front, this 5th vertebra, which when we turn to the side gets covered by our iliac crest, this one, when we're standing, can look very little and shortened. So that's going to be right here. Very little, I'm sorry, there it is. Little and shortened. Then we go into the sacrum. So when we're looking at our x-rays, it gets a little distorted on that front view. Now, hey Britta, good of you to join. but shouldn't you be going to practice? Anyways, so when we're looking at our vertebrae, then we have our disc in the middle, and those green discs are usually what cause the biggest concern. So if you've ever been told you have degenerative joint disease, have you ever been told you have arthritis? Have you ever had a degenerative disc or a disc herniation or a disc bulge, or you're having sciatic pain? Those are all fairly common terms kind of tossed around within my profession. And I want to kind of make them less scary, because whenever you hear degenerative, that's a scary word. But is it truly as bad as it is portrayed within the medical field? So I want to kind of break that down. So if you have any questions, or if you've ever been told you have a big scary thing, let me know, and I'm going to help you navigate those waters. Now, within the anatomy, the top, our neck, so let me see, our neck here, our cervical spine. Then we have our mid-back, which goes from about our collarbones down to the bottom of our rib cage. That's our thoracic spine. Then we have our lumbar spine. And we're going to mostly talk about the lumbar spine because that's where we have most of our back pain. And in between each spine, each vertebra, we have these little yellow discs. And these discs essentially are the shock absorbers and allow us to take as many impacts as we do. So when we jump and land, why we don't have multiple fractures, when we're playing sports. Now, as we age, the bones can get a little weaker, which is called osteoporosis, and that can lead to the disc not being able to provide enough cushion and then leading to a fracture. So I just want to kind of throw that out there, that there always is kind of this potential for some anatomical changes. So I'm just getting my comments set up so I can make sure if anybody has any questions or comments, you can go ahead and just comment below. If you're watching this on replay, go ahead and hashtag replay. I'm happy to go back and answer questions. So some of our big scary terms, sciatica. What is sciatica? And when I'm explaining this to a patient who comes in, oh, I have sciatica, I have stuff in my legs. Well, there's a very specific way that sciatica affects us. So one, it can have some low back pain, and it's really going to be in that low back right by that sacrum. So it's going to be kind of down in this region to one side. It then will have numbness and tingling or burning down the back of the leg in the hamstring, and depending upon what's causing it, it could go below the knee all the way to the foot, or it could stop at the knee. Now, depending upon where it stops and starts, helps determine what we as healthcare professionals would help you determine is going on. So, if you're having pain anywhere down the back of the legs with low back pain, you definitely need to get seen, because a potential cause of that is a disc herniation or disc bulge. Now, this is simply where the squish, so the cushion of our disc, has been popped out. It's very similar to like a stress ball that has gotten a little bit of a hole in it, and you squeeze it and a bubble comes out. Now, it doesn't squirt out, it doesn't destroy anything, it doesn't create any damage. It just expands out and balloons beyond what you would normally see as that stress ball shape. Now, that ballooning then can go into and touch different nerves. And that's what can create those different sensations. Now, does having a disc bulge or a disc herniation automatically mean you need surgery? No, it doesn't. Research has started to show that having a disc herniation or disc bulge and having surgery compared to going to a chiropractor, going to a physical therapist, you have the same outcomes in the same amount of time. So why take the risk of having a surgery if it's not entirely necessary? So another thing that is commonly diagnosed on x-ray is degenerative joint disease. And in all honesty, almost everyone over the age of 25 will have some type of degenerative joint disease. It doesn't mean they have pain. What it does mean is they've lived. They've done something. I have degenerative changes in my low back from when I was in high school and I was a high jumper. And I, in my graceful self, missed the high jump mat. I had taken 2 steps too many. I had jumped and cleared the bar, and I floated straight past the mat and slammed my spine into the concrete. Not my best move. And yes, it hurt a lot. But what was really nice is that I had x-rays in chiropractic school, and although I had some slight changes, I found out I hadn't done any significant damage, and I didn't have any low back pain. So having changes to your spine is similar to having a scar. An x-ray, an MRI, a CT takes a picture. And just like all pictures, they don't truly tell the emotion of what's going on in that scene. So there are times you can have a scar that appears on an x-ray that's not a problem, but we don't have a way of differentiating, is that the thing causing pain? So unlike if you get a cut on your leg, it heals, leaves a scar. When you initially had it, it was very potentially painful. Now that it's healed, you still have the scar, but it doesn't bother you. X-ray doesn't give us as clear, or MRI or CT, give us as clear an image of, is what we're seeing an injury that is happening right now, or is it a scar, a remnant from a prior injury? We haven't been able to differentiate those well. So when it comes to looking at that and seeing that, or being told you have degenerative joint disease, it really doesn't mean anything. Anyone over the age of 60, there's an 80% chance you have it. And degenerative joint disease is essentially arthritis. And arthritis doesn't even necessarily mean you have pain. It's just something that's synonymously, when you're having issues, you go get imaging and they potentially diagnose you with it, and then you think, oh my God, I have this, because they don't take the time to explain, well, you have it, it means you lived a good life. Now, our final term on this slide is scoliosis. Scoliosis is an abnormal curvature of the spine. So there are normal curves that we have. So in our neck, we expect it to have a backward C, to our thoracic spine have a forward C, to our lumbar spine have a backward C, similar to this here. So backward C, forward C, backward C, forward C. And basically that's going through a lordosis, a kyphosis, a lordosis, a kyphosis. So if you ever heard those terms, they're normal. Lordosis and kyphosis just indicates which way the curve is going, and it's how we communicate clearly as medical providers to figure out what to clearly indicate what's going on. And it's just a way for us to communicate. Now, a scoliosis is when you have the spine facing the front and then you get a bend. And these bends create these curves in the spine. Now, this isn't a very dramatic one. They can be bigger, and they're typically diagnosed as adolescents. It's where you bend forward, touch your toes, and they see a difference in how your shoulder blades. So we expect them to be even when you bend forward. Occasionally, we'll see where one humps up. And that rib humping sign can indicate that you have a scoliosis, which then we'd want to get x-rays on and see how much of a scoliosis, because most are no big deals and they're not going to affect you. They might change how you run a little bit. They might change different things, but ultimately they're no big deals. And occasionally they can be more significant. So the younger you are, and I'm talking pre-puberty, pre-growth spurt, if you start being diagnosed with a scoliosis or your kiddos are being diagnosed with a scoliosis, that's a bigger concern, because as they grow, that curve can progress, and that progression can lead to the need for bracing and potentially surgery, depending upon if the scoliosis affects the organs or breathing or anything like that. So scoliosis is something that when we see it as an adult, for the most part, it's a no big deal. Now, again, caveat, most part, no big deal. There are times when we have scolioses that develop later in life that could be indications of something a little bit scarier. But if you've had it your whole life as an adult, it's generally not going to change. Now, I kind of covered some spinal curvatures and inverse curves. Sometimes when you go see a chiropractor, they get very caught up in correcting your curve. I haven't found it to be as beneficial for patients to have curve discussions, because here's the thing. Sitting in an ideal posture is great, but ideal posture doesn't allow me to tie my shoes. Ideal posture doesn't necessarily allow me to squat heavy weights, play basketball, do different activities. What it does do is potentially sitting here in good posture alleviate some stress on my spine. But sitting like this doesn't really cause me any harm. If I try to reach above my head, I can't reach as far. So if I sit up straight, I can reach further. That's really what posture and spinal curvatures do, is it's more about functioning in a normal position versus causing pain. So if anybody's saying, hey, I need to correct this curve is going to cause you harm because your neck is not in an ideal lordosis, move on. It doesn't matter in that way. I've also heard patients come in and ask about their spine twisting on itself. Spines don't do that. They really don't. There are times that we're having a lot of pain and our muscles are spasming and it can be twisting in different ways, but it's really not going to twist on itself and paralyze you. I have had someone come in and say that, and that's just not going to happen. So if you've been told that, we need to talk, because that's not okay. Now, let's talk about something you can do to help something like a disc herniation. McKenzie Method was developed by a New Zealander. He was a physical therapist, and it is now branched into both the PT and chiropractic realm. Now, I fully admit I am not a certified McKenzie Method provider. I have someone I refer to do this technique, but it is something that needs to be considered if you're having numbness and tingling down your legs and they're recommending that you have surgery. This is a great alternative to try prior to surgery. And it's really based around specific movements you can do at home. Now, this isn't going to be for everyone. There are gates to kind of stop and determine whether it's going to be a good fit for you. One of them is the movement causing more pain to go down the legs? Is it causing more numbness and tingling to go down the legs? Is it causing more issues to go away from the spine? So we would call that peripheralization. That peripheralization, that going down versus going to the spine. So if we're having pain that goes more centrally to the spine, less numbness and tingling down the legs, we're okay with that. That actually indicates that we're helping. We're okay with things going towards but not away. So if anything you're doing is causing pain to go worse down the legs, worse down the spine, then this is definitely something you need to consider changing. Now, for the McKenzie, it's super simple activities, such as laying on your stomach and pressing up into an extension or a cobra pose in yoga. So for that, you can also do it standing. For a lot of low back pain, if you have pain with sitting, this is causing a flexion or curvature of the spine. Standing puts you in an extension. So if pressing back relieves the pain, this might be your exercise, is simply standing there and pressing back. Now, if this increases the pain and causes you to have tingling down the legs, but this position helps, then this simply might be your exercise. Now, these can be done sitting, standing, or frankly laying down with any of the movements. The other two can simply be moving to the sides, and you can do that in either direction. And really we're looking at where did the disc potentially squish out of where it should be. Now, those exercises are done in huge repetitions. So typically when I'm giving a home exercise, I'm like, okay, I want like 2 sets of 5 to 10 repetitions. Mackenzie's not that way. You might be doing 5 sets of 20 to 40 repetitions of those press-ups, trying to get movement up and movement going, which is frankly sometimes insane when you look at the number of repetitions you need to do to get the pain relief and benefit. Now, those are just some very simple terms, very basic information. If you have any questions, please feel free to comment. If you're watching live, please comment #live. If you're watching on replay, #replay. I want to make sure that this information is as simple and easily digestible. Sometimes I go a little deep because I enjoy talking and teaching, but really the low back shouldn't be painful. You should be able to do whatever activity you want, and if it is causing issues, we just need to determine what's the underlying cause, be it a core instability, be it a breathing instability. So I didn't cover this, but I'll do it briefly. Breathing surprisingly affects our low back. And I fully admit that this is something that I've had to train myself out of, because this was causing a lot of my pain issues, is being a chest breather. So that means like breathing through your chest versus breathing through your belly. I was a chest breather because I kept being told, hey, suck in your stomach, look thin. it didn't help I did ballet, and they don't want you to belly breathe. They want you to chest breathe into your arms so it looks more effortless. So you don't look like you're working as hard. But by being a chest breather, I was no longer engaging my core to stabilize my low back with different activities. And I untrained my body to not support myself. I had to retrain placing my hand on my chest, hand on my belly, and just focus on breathing into that lower hand and actually using my abdominal muscles to promote healthy breathing to kind of get things moving in an effective way. An easy way to determine if you're not using your breath with activity is when you're doing planks, sit-ups, anything kind of engaging that core, dead bug, bird dog. Are you holding your breath? If you are consistently with every repetition holding your breath, you need to work on some breath training because you're not using your core with breathing, and that can leave you exposed to injury sometimes. I want to thank everybody who joined me this evening. I see we've had Tim and Jessica and Britta and Andy and Paul and Josh. It is so wonderful to have you join this evening. Again, if you have any questions, go ahead and comment below. If you have a question on replay, hashtag replay, ask your question. I will absolutely go back and answer them. Next week for our live feed, we're going to go back to the basics and just do a medical Q&A. So if you have any medical questions, please feel free to email or PM the office on Facebook and ask your questions if you don't feel comfortable asking them on the live, and I will go through and answer whatever you want. Granted, if I don't know, I'll probably recommend who you should seek the answer from because I am not all-knowing, even if I pretend to be. And I want to make sure that you are able to get any health answers or questions that you need. With that, I will see you again next week on Tuesday at 6:30 CST for our Mobility, Agility, Chiropractic Performance live Q&A, because here at Mac Performance, we always want to get you better faster, keep you better longer, because no one has time to be sidelined. Have a wonderful rest of your evening, and I will see you next week. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.